Just one juice to improve and combat poor circulation in the legs and feet. In this video, I'm going to show you a way to improve your circulation to the legs and feet and make you feel much better. Because millions and millions of people have poor circulation. If your feet are swelling, if you have difficulty walking, if you feel heaviness in your legs, varicose veins, this video is for you. I'm going to teach you the bonus exercise you can do at any time of day to further improve your circulation. And speaking of causes, what is behind poor circulation may be simpler than you imagine, and the answer will surprise you. The causes of poor circulation and what you can do right now. In summary, lifestyle. Your poor circulation is directly related to the habits you have in your daily life. What causes this problem? Inadequate diet, excess refined carbohydrates including sugar, accumulation of plaques in the arteries, atherosclerosis, which is a consequence of an unhealthy lifestyle, diabetes, another consequence of an unhealthy lifestyle, as well as overweight, obesity, and hypertension. All of this damages your vessels, damages your cardiovascular system, and generates poor circulation. But I want you to know that there is a very simple measure you can take at home to have immediate changes and start feeling much better. But you need to change your diet, you need to exercise, you need to make an effort to maintain a healthy weight. There is no magic solution, but there is a real way out. What I'm going to show you today will certainly generate excellent results. But don't fool yourself. There is no magic juice, magic drink, magic pill, magic remedy, magic doctor that will make you maintain the results permanently, unless you take responsibility for your health and make the necessary changes to your lifestyle. Now that you know what is causing the problem, it's time to find out what the #1 ingredient in this recipe is and why it acts directly on your arteries. Beetroot and the nitric oxide that dilates your arteries. When it comes to food, there is little doubt. Beetroot juice is unmatched when it comes to promoting the production of nitric oxide. What is nitric oxide? It is a gas that is also a nutrient for our body. The main function of nitric oxide is to promote the dilation of the vessel, relaxation, not only in the legs and feet, but throughout the entire body. So when you have a narrow artery, it may be an artery that is narrower because there is a fatty plaque in it, preventing blood from flowing correctly. When this artery is narrow, less blood passes through it, so there is less blood flow reaching the region, the feet for example. And this can even lead to greater fluid retention, causing swelling. How beetroot reduces blood pressure and protects your heart. Once generating vasodilation and strengthening the muscles in the region, the problem tends to improve. In addition, nitric oxide also helps reduce blood pressure and reduce the load on the heart. So our first ingredient here is beetroot. In this juice, we always talk here about the importance of beetroot in combating poor circulation problems. But beetroot alone does not do everything. The second ingredient has a story that few people know, and that explains why blood vessels become fragile without it. Orange and the collagen that protects your blood vessels. The second ingredient in the juice is orange. This time, it is not lemon, it is orange, which is rich in vitamin C, an antioxidant, anti-inflammatory substance that, more than that, is essential for the production of collagen in your body. Collagen is the protein that gives integrity to your blood vessels. We talked about this during the Great Portuguese Navigations. This story is very well known. Sailors suffered from scurvy, a disease that, among other clinical manifestations, presents itself with gum bleeding. And this bleeding is caused by a collagen deficiency, which in turn is caused by a vitamin C deficiency. So, without vitamin C, you cannot produce collagen. And without collagen, your vessels are not intact. They become fragile, and then they can rupture, causing bleeding. What vitamin C does for your arteries beyond preventing bleeding. In addition, vitamin C promotes good circulation, prevents damage and weakening of blood vessels possibly caused by oxidative stress, reduces the risk of atherosclerosis, which is the accumulation of cholesterol plaques, and the hardening of arteries. And vitamin C promotes cardiovascular health. And the next ingredient is one that everyone has at home, but few know that it acts directly on blood pressure and cholesterol at the same time. Carrot and the potassium that combats hypertension and cholesterol. Our next ingredient, which everyone will also have at home, is carrot. Carrot has carotenoids, anti-inflammatory and antioxidant substances. Carrot has vitamin C. Carrot has potassium, a mineral essential for your circulation because it also has vasodilatory properties. Many times a person has hypertension because they do not consume an adequate amount of potassium and also magnesium, another mineral essential for the proper functioning of your cardiovascular system. Carrot also has vitamin K and has many fibers, making it an excellent ally for reducing cholesterol and reducing blood sugar levels. So, diabetic people who are having trouble controlling their blood sugar levels, carrot can be a good ally for you. Carrot also stimulates nitric oxide, just like beetroot. And it also improves the production of nitric oxide in the same way as beetroot. Now, the last ingredient may seem simple, but there is a detail about honey that many people do not know, and that makes all the difference in the recipe. True honey and the secret of nitric oxide production. The next ingredient is honey, which has various medicinal properties. Oh, doctor, is it the glucose syrup that comes in that one, which is a fake honey, which is just sugar? No, it is honey from bees. Bee honey has sugar, has carbohydrates, yes. But beyond that, it has antioxidant substances, has phenolic compounds, has flavonoids. And all of this makes it have anti-inflammatory properties and also stimulates the production of nitric oxide. So all these foods that I brought here, these 3 foods in our juice, all of them promote the synthesis of nitric oxide. Why mouthwash may be sabotaging your circulation. An important warning here as well. If you have hypertension, it is not advisable for you to use mouthwash. To take advantage of the nitrate from food, you need certain bacteria to be present in your mouth. If you use antibacterial mouthwash, you will kill all the bacteria. And then what will happen? You will not be able to convert the nitrates present in beetroot, for example, into nitric oxide. That is why several studies have already shown that the use of mouthwash, such as Listerine, any oral antiseptic, can increase the risk of arterial hypertension. So, if you are at greater risk of hypertension and use these mouthwashes, be careful, because this can be a hidden cause of your problem. And now that you know all the ingredients and their effects, it is time to learn exactly how to prepare this juice and when to take it for the best possible result. The complete recipe and the ingredients you will need. Grab a pen and paper. You will need 1 glass of beetroot juice. How do I make beetroot juice, doctor? Take the beetroot and blend it in the blender. You will also add the juice of half an orange if possible with the peel, as long as you clean the peel well, preferably from an organic orange, and half a carrot, and 1 teaspoon of honey. If you cannot use honey, I am sorry, but you will not be able to sweeten this juice. People talk a lot about stevia. People talk a lot about sucralose. Did you know that stevia, as much as it is something widely used, before being approved, it was banned by the FDA, which is the American equivalent of Anvisa. So we do not have information on the long-term effects of stevia, and for this reason, I do not think it is interesting to consume it. All these artificial sweeteners, I do not find interesting. The right way to prepare and the best time to drink the juice. How are we going to make this juice? You will put everything in the blender, the beetroot juice, or the beetroot itself, the orange, the carrot. You will blend everything, pour it into a jug, wait a few minutes. If you want to add ice, add it, and drink it slowly. There is no specific time to take it. I recommend that you do not take it close to bedtime because otherwise it may cause you to need to get up several times to urinate during the night. So my recommendation is that you take it during the day and not at night. But the juice alone is not enough. There is a simple exercise you can do at any moment of the day to further accelerate the results. And I will show you now. How the nutrients in the juice act directly on your circulation. Your circulation will improve because the nitrates present in these foods will become nitric oxide. And then this nitric oxide will promote vasodilation. The other nutrients present in these foods are also beneficial for your circulation. mainly because they have antioxidant, vasodilatory, and anti-inflammatory properties. 3 characteristic properties that are very welcome in people with poor circulation. If you are going to make beetroot juice, you can add 1 to 2 cups of water to adjust to your taste, since the flavor of beetroot is strong. Beetroot tea can also be an option, but what really matters is consuming beetroot, preferably raw. And to give an even better effect, you can add a pinch of turmeric with black pepper, or even add cinnamon and cloves to give more flavor. The bonus exercise that improves circulation at any time of day. Now, pay close attention, because I am going to teach you an exercise for the feet and legs that will strengthen your muscles in the region, and consequently, improve your circulation. Move your feet up, down, to the sides. Rotate your feet. When you do this, you contract the muscles of the leg. When you contract the muscles of the leg, they exert pressure on the veins, contributing to the blood returning to the heart, improving circulation and swelling in the feet. And if you think that operating on varicose veins solves the problem once and for all, what comes next will completely change your view on this subject. Why you need to move, even if you feel pain in your legs. I want you to exercise frequently. If you cannot go to the gym to work out your legs, I want you 3-4 times a day to do this exercise with your feet, putting them forward, putting them back, to one side to the other, rotating. If you do this, your circulation will possibly improve. I also want you to start doing physical activity, to start walking more, even if you have knee pain, even if you feel a little pain in your hip. Just getting up, moving your feet, shaking your body, just that will already help a great deal with circulation. Sedentary behavior contributes to poor circulation. First, because you do not strengthen the muscles of the leg. And second, because if you are sedentary, the chance of you being diabetic, hypertensive, with high cholesterol, anxious and depressed is very high. So I want to challenge you here today to start introducing beetroot juice with orange, carrot, and honey, and drink it daily. It is possible that you will start feeling so well that you will want to drink it 2, 3, 4, 5 times a day, but I recommend that you start with just 1 glass and see how your body reacts. I am convinced that this simple measure will be useful in improving your circulation. Why varicose vein surgery does not resolve the cause of the problem. Diabetics obviously need to be a little more cautious because honey and, depending on the person, beetroot can also raise blood sugar levels slightly. But this does not happen with everyone. And beetroot can indeed be consumed by diabetics as long as it is included in a healthy lifestyle as a whole. There is no point in fooling yourself and thinking that you will drink 1 glass of this juice and do not need to do anything else. This juice will help, yes, but it does not replace a healthy lifestyle. Because what caused your problem is your lifestyle, your behaviors, your daily habits, your diet, your sedentary behavior, the fact that you drink and smoke, the fact that you are a very stressed person who cannot control that feeling, the fact that you do not sleep well. What really happens when varicose veins return after surgery? Oh, doctor, I am full of varicose veins. I had surgery on them. After 1 year, they all came back. Of course they all came back. Because surgery will not solve the problem. It will not act on the cause of the problem. Surgery will specifically resolve the patient's complaint, which are those varicose veins there. But it will not act on the origin of all this. Surgery will not act on your diet, on your level of physical activity, on your stress management. So, if you continue eating poorly, sedentary, stressed, not sleeping well, drinking and smoking, varicose veins will keep appearing. Because the causes of varicose veins were not eliminated by surgery, and they will not be eliminated by any medication. But there is a point that few people understand about hypertension, diabetes, and high cholesterol, that the health system is not telling you, and this changes everything. The system that creates the disease and never treats the cause. In the same way, hypertension, high cholesterol, and diabetes are also diseases that are not resolved with medication. They are controlled, and often poorly controlled, with medication. We live in a system that contributes to the emergence of disease. We go to the supermarket. There is no healthy food. It is all sugar, all low-quality fat, all vegetable oil, all ultra-processed products. The person only eats this, becomes diabetic because they also lack information. The system creates the disease. It diagnoses the disease. And increasingly, we are classifying what was normal as disease. The blood pressure that everyone knows is normal, 12/8, is no longer considered normal. Now 12/8 is considered elevated blood pressure. ADHD. Today everyone has ADHD. You go to the pharmacy and there is no such thing as that Venvance, that amphetamine that people love to take because they think it will improve their performance. There is none. Why? Because increasingly we are diagnosing more diseases, treating what is not disease, and doing nothing to solve the problem. Why blood pressure medication does not treat the cause of hypertension. What is the cause of hypertension? Is it a deficiency of amlodipine? Is it a deficiency of losartan? Am I eating too little losartan in my diet and will have to supplement it with a pill? That is not the cause of your hypertension. And if you keep taking the medication but do not change your lifestyle, you will keep taking medication forever. And all these diseases I am talking about here, hypertension, diabetes, high cholesterol, the first treatment begins exactly where you least expect it.